Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This week, Mississippi's hospitals in crisis. Key regional facilities are shutting their doors or cutting important healthcare services, and more of our neighbors face the prospects of their communities becoming healthcare deserts. We'll learn more with testimony from a state legislative hearing this Sunday on Mississippi Insight. Last Monday, as most state politicians were looking forward to Thanksgiving dinner, the State Public Health Committee held an important hearing on Mississippi's hospitals. Greenwood LaFleur Hospital in the Mississippi Delta is the most immediate example of a major healthcare facility facing imminent collapse, but they're not the only regional hospital in turmoil. In Jackson, University Medical Center is still feuding with Blue Cross Blue Shield over reimbursement rates. Merit Health Central has shut down many of its services or moved them out of the South Jackson location. Forest General Hospital in Hattiesburg and North Mississippi Medical Center both expect to lose tens of millions of dollars next year. Those in other hospitals say that rising staff costs and covering the price of treating the uninsured have made their current business models unsustainable. This morning, we are going to replay some excerpts from the Public Health Committee hearing. We'll hear from leaders at the Mississippi Hospital Association and State Health Officer Dan Edney. But first, the man who brought those officials to the state capitol Monday, Democrat Senator and Public Health Chairman Hob Bryan.
And one of the problems we have with healthcare is that we are so reluctant to have regulation and government oversight, and we're so dedicated to the free market that we seem to be unable to look at situations where there's a market failure and where almost every capitalist would agree this is a point for some sort of regulation from above. If you look at where we are today, all of this has just sort of grown up, and individual decisions have been made by individuals making rational decisions from their point of view without any notion about how these decisions were impacting the big picture. In my opinion, what we need is somebody somewhere in state government who is charged with the notion of figuring out, in general terms, what do we want healthcare to look like now, 5, 10 years down the road? How can we bring that about, and how do we plan for it? Unless I'm terribly confused, there is nobody in your state government that has that charge. I guess the governor and the legislature do, in the sense that we're in charge of everything, everywhere, every time, but that's not very specific. The State Department of Health is supposed to have a state health plan to determine what's needed, but they are not charged with the notion of figuring out how we're going to pay for this. I'll bet you the state health plan says we need a hospital in Greenwood, but no one has figured out how to do that.
That's Senator Hob Bryan of Amory speaking before his Public Health Committee. And after the break, we'll hear from the hospital industry itself and get some hard numbers about Mississippi's struggling healthcare systems.
This year marks 37 years that I've been in healthcare. I've seen a lot of change over those 37 years. When I came into healthcare, we were still on a cost reimbursement basis. I've seen that change from cost to DRGs to APCs. I've seen so many payment methodologies change that there are too many to mention. You know, over that 37 years, I've watched healthcare gradually move toward a cliff. And we get closer and closer. The pandemic certainly expedited that process of moving us toward a disaster. More so in Mississippi, though, than we've seen in other states. And it's simply because we've not taken all the measures that we could to mitigate that rapid approach to that disaster. And the time has come that we have got to do something, or we're going to lose a number of hospitals across the state of Mississippi. You know, we received a lot of federal dollars, very appreciative of those federal dollars. They were very specific in what they could do and what they could provide. Those are gone. Now we find ourselves with our hospitals in more financial difficulty and having to pay back loans that came from CMS. So now they're in a greater financial strain, but having to pay back money that was sent to them to try to help them. So challenges that were unanticipated.
That's Timothy Moore, President and CEO of the Mississippi Hospital Association. His testimony Monday before the Senate Public Health Committee offers confirmation from the private sector perspective of the crisis facing our hospital network. But what's behind the facility's financial struggles? Richard Robinson is MHA's Vice President of Policy and its General Counsel, and he offered the committee some strong or troubling data. And even with low average costs compared to other states and high marks for quality, many Mississippi hospitals are facing the very real risk of financial failure. Here's some of what he had to say.
The challenges are exacerbated by the pandemic and the kind of the outgrowth of additional costs that we're seeing throughout the economy. Healthcare is certainly unique in many ways because we were unique in our position related to COVID and the things that we did as an industry. But economics are economics, and at the end of the day, the problems are being exacerbated by costs exceeding revenue. And let me just kind of set kind of level set some of the things, and these are things we already know, but if we're looking at a region, when you're looking at the 2021 median annual household income, Mississippi is the lowest in our region. So no shockers there. It's right around 48,000 on the American Community Surveys. Same thing when you look at poverty rates. We're among the highest in poverty rates in our region. Low annual median household income, high poverty rates, uninsured rates. We're among the highest in our rates of uninsured individuals. Those three data points right there make it really difficult as a consumer of healthcare. So if you're a consumer and you are high poverty, you don't have health insurance coverage, and you have a low annual median household income, it's going to be really tough for you to be a consumer of healthcare. You're not going to be able to purchase healthcare in the ways that perhaps other people do. So that sets up a pretty challenging framework as a business provider, much less as a consumer. When you look at employer-sponsored coverage, which, Mr. Chairman, I thought you did a great job kind of going through the history of hospitals and healthcare, and employer-sponsored coverage was something you mentioned, and that came as a kind of a employer incentive to get people in jobs and compete with different industries back in the 30s and 40s. And now it has become one of the predominant ways that people get their health insurance coverage is through their employer. When you look at how we compare to our counterparts, we're among the lowest in employer-sponsored coverage for non-elderly patients. And this is coverage for people below the age of 64. Over the age of 64, it's far and away covered by Medicare predominantly. And we've talked about this when we were here a couple of weeks ago. Our hospital costs in Mississippi are the lowest in the country, bar none. And it's not even close in our region. And we talk a lot about the cost of living being low, and oh, well, it's, your costs are low because your cost of living is low in Mississippi. Yeah, but cost of living is also pretty dang low in these other states too. And they're not even close to us. So our hospitals are doing a phenomenal job with the resources they have in holding the costs down. And far and away, their costs are driven by labor. It's labor. It's not the bricks and mortar that take care of the patients. It's the hands that take care of the patients. It's the physicians, it's the nurses, it's the other staff in those hospitals that take care of the patients. That's why you go to the hospital. You don't go to see a nice building or look at a clean floor or anything like that. It's the people there, and that's where your labor costs come in, and that's predominantly driving the cost. But compared to the rest of the country, and certainly compared to the rest of the region, they're extremely low. They are the lowest. Our hospitals, again, have the lowest in the country. It's almost $150 per day cheaper than Wyoming, which is the second. Our nonprofit are the lowest inpatient per diem expenses. State and local government hospitals, our community-owned hospitals, of which we have more than 50 in the state, have the 6th lowest national inpatient expenses, and our for-profits have the 7th lowest. And the for-profit range is a little narrower because these for-profits have basically the same business structure, and they operate nationally, and they're not doing things altogether differently across the country. But in Mississippi, the for-profits that we have are the 7th lowest national expenses per day. The last full year prior to the pandemic, hospital industry as a whole was underwater to the tune of $132 million per year, roughly $11 million per month. That's simply, if you look at the cost reports and look at expenses versus revenue, you'll see a $132 million deficit. When you spread that across 114 hospitals, you may think, okay, well, no big deal. And certainly there were some that did very, very well, others that did very, very poorly. But that's not a great number as an industry. Approximately $594 million in uncompensated care in calendar year 2021. That's nearly twice the amount we had back in 2010. 2010 numbers were in the neighborhood of $350 million. So it's grown significantly over the last decade. In fact, almost doubled. In 2019, that number was a little over 600 million. It has come down the last couple of years because you've seen more individuals stay in marketplace plans because the additional, the subsidies that have continued for the last couple of years as part of the COVID relief packages. And then also the Medicaid enrollment has stayed in place for individuals who otherwise would have rolled off. So that's decreased our uninsured for the last couple of years by a few percentage points, which then equates to a little bit of a reduction in uncompensated care. However, it's not a direct correlation because our uninsured cost, our uninsured population has been reduced by about anywhere from 3 to 5% across the board since 2019. But that uncompensated care cost has not decreased, and that's because the costs have gone up. So you may be providing services to fewer uninsured patients, but the cost of providing those services has gone up. Since 2019, costs have increased on average across the industry around 20%. That's primarily driven by labor, but also the cost of supply chain, the cost of food, the cost of supplies, the cost of medical equipment, all those things have gone up, but revenue has not. One factor in this has been the provisions that were put in place back in 2010 under the Affordable Care Act. The Medicare cuts were made in order to pay for Medicaid on the Medicaid expansion side. So from a federal perspective, they were balancing budgets. They decreased payments for Medicare, increased payments for Medicaid. The Supreme Court said, you don't have to do Medicaid. States opted in, states opted out. But if you were a state that opted out, your hospital or your healthcare industry absorbed all the Medicare cuts without a way that was put in place by the federal government to make up some of that. Not all of it, but some of that would have been made up.
Dr. Dan Edney is just 3 months into the job of state health officer, and he's already staring in the face of a healthcare crisis. Edney has warned Mississippians that many communities, especially in rural areas, will lack convenient healthcare access for thousands of Mississippians if something is not done to stem the tide. Here's some of what he had to say to the Senate Public Health Committee.
As the Mississippi State Department of Health, it is our responsibility to license and regulate all the entities that you see on this slide. But for today's discussion, most importantly, our acute care hospitals and our critical access hospitals. And starting January 1st, we will have the new designation of the rural emergency hospital status. I'll talk a little bit more detail about it in just a bit. But you see that the Department of Health license between acute care hospitals and critical access hospitals, 92 hospitals around the state. And currently it's estimated, and I've given you a copy of the report, it's estimated that 38 of our hospitals, of our rural hospitals statewide, are in danger of either immediate closure or closure in the near term. Now, we're already seeing cutback in services. And this came to my attention in August, very quickly after I assumed the role of state health officer, when Greenwood LaFleur had the sewage leak that you may remember that caused the hospital to be closed. And that brought to my attention, away from the water crisis that we were dealing with, that the census was very low for an acute care hospital. And it surprised me as a practicing physician of 31 years as an internist. And did I mention I was trained at the University of Virginia in internal medicine? I went longer than 90 seconds, but.
No, you're like 3 or 4 minutes into your presentation and haven't worked that in yet.
But having practiced in acute care hospitals for 31 years, I mean, the business model is based on volume. And when there is no volume, then that is not a sign of health for any business. When I saw low volume in census at Greenwood LaFleur, then I started looking around the Delta at census numbers. It was alarming to me at that point that something was going on in the Delta specifically. So when you look at 38 rural hospitals around the state closing, that's 54% of our hospitals, ladies and gentlemen. And I would stand here today to let you know, or certainly I think to agree with you, that that's a situation that is intolerable from an economic standpoint, to lose 54% of our hospitals in the state, much less from an access to care perspective. Now, obviously, that's assuming that we do nothing. We do nothing but allow the train to keep rolling down the track on its current trajectory. This is the outcomes that we can expect to see. And I'm speaking here from a public health standpoint, looking at the data that I have. And it's not just Mississippi. I've given you the national reports. You can look at every state at the number of rural hospitals in each state that are in danger of immediate closure or closure in the near term. Mississippi is just at the top as usual. So if we do something, and I'm certain that we all will, but if we do something, I think at the very least, we're going to be seeing what we're already seeing, and that significant reduction of services. So it was alarming when Delta Regional and Greenville closed the NICU. That was an access to care issue in the Mississippi Delta. And then very quickly, when Greenwood LaFleur stopped delivering babies in the heart of the Delta, that was very much an access to care issue for me, as Mississippi has the highest maternal infant morbidity mortality in the country. We need to be improving access to care to keep our mothers from dying in pregnancy, not restricting it. So even if they don't close, we're going to be seeing more reduction in services statewide. So if you have a small rural hospital in your community that you represent, you need to be concerned of what the future of that little hospital looks like. So I've included for you, this is a map of the state, and you'll be able to take that information with you, but it indicates every acute care hospital and every critical access hospital throughout the state, and whether it's in the Mississippi Delta or if it's outside the Green counties. I would let you know, Senator Hobson and I, being from Warren County, know that Claiborne County and Jefferson are much more like Delta counties than Warren County actually is. So you need to pay attention to those two counties. They very much behave as Delta counties. But approximately 20 hospitals total in this zone, half of which are acute care hospitals. And I'm looking at the counties of the information that I've been watching. Maybe 3, maybe 4 of those acute care hospitals are doing pretty well. The rest are either, we have one that we're doing CPR on now, and we have a few that are in the intensive care unit being ventilated. Then we have several on the floor that aren't doing real well. So they all are in need of treatment. The critical, and then I've indicated for you, you can use that for your reference later, outside the Delta. And I can tell you outside the Delta, there are at least 5 or 6 hospitals that we have significant concern about that have different challenges than the Delta. I try to remind people, you know, Mississippi is not one organism. It is made up of many different parts. The Delta is a unique region, but so Southwest Mississippi has its own challenges. The Gulf Coast is different from the Pine Belt, which is different from Metro Jackson, which is different from Northeast Mississippi. They all have different challenges. They all have different levels of resources, but they all have their own unique problems. And majority, or at least half of these hospitals are not doing very well at all.
That's State Health Officer Dan Edney. Testimony such as this will likely build pressure on state leaders to find meaningful solutions to the hospital crisis. Governor Tate Reeves has suggested reforming state certificate of need laws to make it easier for companies to build hospitals here. But he continues to resist calls for Medicaid expansion, a move that would substantially increase coverage for uninsured Mississippians. We'll see whether those calls echo through the State House and Senate in the 2023 session, beginning in January. We're back in a moment. For more testimony from the Senate Public Health Committee hearing on hospitals, go online to youtube.com/Mississippi Legislature and join us at 6:30 next Thursday evening, December 1st, for a special edition of Mississippi Insight focused on the state's retail sector. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.